Greetings and welcome to this episode of the Conscious Business Coffee Break, where we take a few moments to explore what's happening in the conscious business movement, expand awareness, and support your efforts in conscious business. Greetings, everyone. My name is Stephen Donaco of the Conscious Business Enterprise, a division of Humanities team. And on today's program, we talk about innovating healthcare solutions for business. And my disclaimer for today's episode is that I'm going to be talking about something that is completely a US-centric problem. So if you're tuning in from another country, please pardon this narrow focus of this topic. But I do think it has lessons for conscious business. So I trust that it will be of value to you, regardless of whether you live here in the United States or not. And the news item that I'll post in the comments to the video subsequently is from Reuters. Came out the other day, and it's titled "Fed Up with Rising Costs, Big U.S. Firms Dig into Healthcare." And this story starts with a piece about Cisco Systems, the technology company, and that how it's gone through a process of trying to control the relentless increase in its healthcare costs for U.S. employees. And Cisco is among a handful of large, and I'll underline that, large American employers who are getting more involved in managing their workers' health instead of looking to insurance companies to do it. And Cisco began this last year with a plan it negotiated directly with the nearby Stanford Health Medical System. And under that plan, the doctors are supposed to keep costs down, medical costs down, by a couple of different things. One is closely tracking about a dozen health indicators to prevent what could be expensive emergencies down the road. And these include like glycemic levels for diabetics and blood pressure for those suffering with hypertension. And then there's also a patient satisfaction component to this. So the idea here is that employees are hoping or should have a high degree of satisfaction so that they're happy with their care. And key to this is that in this case, Stanford, and for some of these other companies, whoever the healthcare partner is, that partner needs to be committed to really improving a patient health first and foremost, rather than just offering the company a discount in order to win a big client. So particularly with Cisco, if Stanford meets those goals of those health indicators and the patient satisfaction, Stanford will get a bonus. And if it falls short of those goals, Stanford actually pays Cisco a penalty. Now, at the center of this for Cisco is that there's an on-site clinic at its San Jose, California campus. So this is the first point of contact for employees interfacing with the doctors as part of this plan. And Cisco had reported that costs for this Stanford plan are 10% lower than the conventional coverage used by most of its employees. So this is still very new, and it's not used by all employees, nor are they required to use it. But there is a cost savings for those who are using it. Intel is another company that is claimed it saves 17% on workers enrolled in a similar plan. And then Boeing and Walmart have also negotiated health plans directly with providers. So this movement is very small because it is tailored for large U.S. corporations. And it's still very new, partly because it's really for these big companies. And now another related piece is that Amazon, JP Morgan Chase, and Berkshire Hathaway recently said, and this was in January, that they're going to form an independent company to improve healthcare for roughly 750,000 U.S. employees. And this prompted speculation that this conglomerate, or this company created by those three, Amazon, JP Morgan Chase, and Berkshire Hathaway, would displace health insurers and other industry quote-unquote middlemen. Now, these early efforts, Cisco, Intel, and so forth. These early efforts show the challenges of changing behaviors among both patients and doctors. And first among these is habits. So many workers want to stay with the conventional plan because they like their doctors or they worry about access to specialists. And because under this negotiated plan, you basically have a much narrower choice of doctors. It's the ones that are available in the negotiated plan versus those that you might choose to see as a person or employee. Methods of treatment also differ somewhat. So, for instance, treatment for back pain might begin with physical therapy at the clinic versus doing something more drastic or surgical. So even among the consumers, there needs to be an acceptance of different care approaches. And then technology is also critical to curbing costs in this model. So for instance, in Oregon, with one of these plans, patients are encouraged to use video conferencing to speak with their doctor when appropriate. And that cost of that video meeting is about $50, which is 1/3 of an in-person office visit. Boeing, which is another company that's done this, it's hit some snags with plans that it negotiated directly with hospitals in 4 states. One is on the plus side is that doctors have willingly prescribed generic drugs, which are cheaper, of course, but getting those doctors to commit to something like a physical therapy alternative treatment before scheduling a costly, let's say, knee replacement has been harder because there's more money, obviously, in doing the surgical procedure. So this is leading some healthcare experts to really bring up the inherent conflict for providers, so that if they're doing more preventative care uh, and delivering uh, better care, preventative care, more forward thinking or proactive care, uh, they will lose out on these profitable services like hospital admissions and surgeries. So then this leads me to to ask the question, at least here in the United States, what is healthcare really about then? Is it profit over people? And it seems like these habits that we have experienced for so long here in the United States, we really, our experience is that healthcare is first about profit versus people. And of course, the Hippocratic Oath would tell you differently. So a couple other things I want to say about this story is that, on the one hand, it's good that big business is being innovative about improving employees' health care. Uh, this is where a business can be a positive force for good. And the on the flip side of this, unfortunately, small and even medium-sized businesses are not in the position to create these kinds of self-managed plans. So this really is only applying to very large companies that have a critical mass. Companies need thousands of employees concentrated in one place so that the structure for this, like the clinics and so forth, makes sense to implement. And so then I wonder, is big businesses' energy better spent working with the government to positively impact the entire system and not just try to localize it for its own employee population, um, which is a very self-centered, siloed approach. And of course, U.S. business is really good at lobbying, spending millions of dollars to lobby for its other interests. So I wonder if in a case like this, would business be more powerful if it came together and lobbied the government for a more universal system in the United States versus these siloed systems, which are all different. And of course, it depends on whether you're employed or not. So if you work for Cisco, you get this plan, but if you decide to leave, then you're going to go back into the system as it is. So can big business actually be more powerful and be more conscious by lobbying the United States government to improve the entire system for everyone? So this speaks, in my estimation, to Conscious Business Declaration Principle number 5, which is that business must behave as a positive and proactive member of the local and global communities in which it operates. So, get out of the silo of your own little universe, your own world, and as a conscious business, look to improving the local and global community for everyone. And this is what conscious business is going to be going forward. The trends as these upcoming generations mature and grow up is that it's no longer going to be, every man for himself, as it were. Uh, that in the spirit of oneness and with increase of we consciousness, we will see these things transform for the better on behalf of all. So that's it for today on the Conscious Business Coffee Break. We meet again on Friday, 9 a.m. U.S. Central Time for another edition. Thank you for everyone who has been watching today and commenting and just saying that they're here and they're showing up. Happy to see you all. And thanks for your interest. We'll see you again on Friday for another edition of the Conscious Business Coffee Break. Have a great day, everyone.